Sexual assaults are deeply personal attacks and can be devastating to both victims and their families. On June 1st, a sexual assault occurred in our own community. To better inform ourselves about resources that can be accessed, we're here with Manager of Community Engagement, Gayle Jaffe from the Boston Area Rape Crisis Center to talk about what options are available for victims, their families, and communities. Gayle, thank you for joining me.
Thank you. It's great to be here.
So I would like to start off and sort of just jump into this. If you are a victim, of a sexual assault or a rape, what are your options?
So there are actually a lot of options available to people who have survived a rape or another sexual assault. And at the Boston Area Rape Crisis Center, what we do on our so we have a 24-hour hotline that's answered 7 days a week, and we generally start by talking to survivors about the array of services that we have available, but we really focus in on what the immediate needs are of the survivors. Sometimes there is medical care that is warranted, and so we will have medical advocates who will meet survivors in emergency rooms at the hospital. We have counseling services available, and it's really, all of our services are free and readily accessible. And we really look to work with survivors to identify what their immediate needs are, particularly around safety, but then thinking about more general recovery and healing.
And are these options different if you're a minor versus if you're an adult?
They are somewhat different. So at BARCC, our acronym, we work with survivors who are ages 12 and up. And underneath that, below the age of 12, there are different resources that are available, mostly because they're just younger ages. So the difference really is, sort of the type of counseling that we might offer and what's available to people when they go to the emergency room.
If you know someone who, has experienced this, what can you do with your organization?
So we offer services to what we term significant others. So basically partners, relatives, friends, people who are involved with survivors of sexual assault and who care about them. We'll certainly provide counseling over our hotline. That's something that we make widely available. It's not just a crisis line. It's some place that people can get support. We also offer in-person counseling for anyone who's impacted by sexual assault, not necessarily themselves. And in addition to the individual counseling, we do run groups for significant others too.
Right, so if someone does choose to report their assault or rape, are they able to stay truly anonymous?
No, they're not.
No.
There are rape shield laws that are in effect that will protect a survivor's identity. So that's why when you hear about a sexual assault in the media, there are very little details that are generally made available about, say, someone's name. Sometimes you'll get an age or a neighborhood, but you won't get someone's name, and the personal details are very much protected. So there's a way in which survivors can retain a certain amount of control and anonymity when things are reported, more publicly. But when something's reported to the police, it's not anonymous.
Right. What strategies do you offer at BARCC to help, victims go from victims to survivors of something like this?
We start really, from the get-go, again, with helping people to identify what it is that they're needing and wanting. We work off of an empowerment model, and so we really strive to provide the kind of support and counseling and resources that match a survivor's needs and wants. And so we try to help people when they're in crisis to transition from that immediate crisis period into a more ongoing process of recovery and healing, be it through our counseling services, connecting them with resources in the community, and helping with whatever they're needing in the way of support and processing.
Right. Well, obviously this unfortunate event has affected our community really strongly. What do you guys do at the BARCC to help communities directly deal with something like this?
We do quite a bit of community outreach and responsiveness when a sexual assault happens, because we know that it has such a ripple effect in the community, whether it's somebody who's directly affected, their immediate social circle around them, but also the community at large too, when a case, especially a high-profile case like this happens. And so we really approach it again from an empowerment model standpoint and are available to respond to communities and to help them sort through what it is that they are needing to restore safety and feelings of security in the community, and working around, oftentimes there are a lot of feelings of helplessness when something like this happens, and certainly, very real concerns about, personal and community safety too. And so we'll respond in a crisis sort of fashion, but we're also available to work with communities around thinking about shorter term and longer term prevention strategies too.
Right. I know that there are a lot of, myths and stigmas about sexual assault or rape. What are some words or, social attitudes that you guys project to sort of minimize those effects?
So I think that we really try to make sure that we have available accurate statistics and other information that that people can really refer to when they're wondering about, say, how often this happens, who sexual assaults happen to, and to counter some of the more prevalent messages or beliefs that are out there about sexual assault. For example, a lot of what makes headlines, and understandably so, are assaults like the one that took place in Arlington, where it was, there are very few details available at this point, but something like, say, a break-in and attack by a stranger. Those are the things that make headlines, when what we actually know is that the majority of assaults happen between acquaintances, and so the assailants are known to the survivor. So those are the types of things that we work to really, sort of make more prevalent and have more people aware of those things.
Yeah. So if someone does choose to report the attack, what then do they do? What steps do they have to take, to go on with this?
That's a great question. There are actually a lot of different options available. We work pretty closely with survivors and their significant others to think through the different steps of the process, to have accurate information and to make informed decisions that will best meet wherever they're at. So once an assault is reported, depending on the type of assault that it is, there are different options that survivors have. We have legal advocates and case managers who will work with them in the system. If a case, once it's being investigated, if it does say go to a DA's office, if they do pick it up, if they do decide to prosecute, we're there to really support them and to make sure that they're getting the most accurate information to make informed decisions, and again, to really empower them to make those decisions along the way in the process.
Right. What are some misconceptions about this process? I know people aren't very optimistic about it a lot of the time.
I think that what we hear a lot of times is there's a reluctance to come forward and report in the first place. So what we do know from different data sets that are available is that sexual assaults are vastly underreported. There's a lot of shame, there's a lot of stigma around reporting a sexual assault. And in a number of communities, there can be a fear of coming forward to law enforcement to report that. A lot of that varies culturally from personal experience or just from ideas about what might happen at that point. So that's something that definitely is experienced. And then I think that people have different ideas of what will happen once an assault is reported, that they may lose control of the process and sort of have to relive their trauma, tell their story a number of times, go to court and face an assailant and potentially be in a really re-traumatizing experience. And that's definitely something that we hear quite a bit of.
Yeah. So is there Are there limitations when it comes to reporting a rape or an assault?
There's a statute of limitations in terms of how many years people do have to report an assault after it happens. If it's something that has happened in childhood, that timeline starts when someone turns 18. Otherwise, it starts after an assault has occurred.
If you do choose to report this, what happens if you decide you don't want to go through it anymore and you back out halfway through? Is that an option?
I would say for the most part that is an option for people, certainly, both with law enforcement once a report has been filed and also with the DA's office. They generally have had training around providing trauma-informed services and really working with survivors so that it doesn't become a re-traumatizing experience and so that things don't feel like they're out of control and out of the survivor's control. But that said, there are decisions that are made on more of an individual basis, and so it's not guaranteed that a DA's office won't pursue charges that are made. So I would say that, you know, it's something that survivors can certainly consider and that can talk to our legal advocates about to get more information in order to make the best choices for them.
So if someone wanted to contact the BARCC to reach out for whatever reason, is their information kept confidential?
Absolutely. We maintain a high degree of confidentiality. Our hotline services are certainly confidential. Our in-person services are also confidential. There are some exceptions to that rule when we do need to break confidentiality, say around suicidality or homicidality, cases where there may be abuse or neglect of a minor. In that case, we do work, you know, directly with survivors around what it is that they are sharing and how to go about that process. But we are very protective, and the laws are really in favor of the survivors in keeping those records confidential.
Great. And are these resources free?
They're free and they're available to the public, absolutely.
Where can our viewers go for a little bit more information about this if they want to learn some more?
Certainly our website, I know it's going to be posted. It's BARCC.org. There is a lot of information on there for survivors, for significant others. There's some in terms of what's available to the community, and there are other resources to link to if people don't find what they're looking for or they just want some more information.
Great. Thank you so much for speaking with me, Gayle. I certainly learned a lot, and I think Arlington as a community will be really grateful for all you've done for us. Thank you so much.
Thank you for having me. We're certainly available to the larger community and to individuals as well to support people through healing.
Thank you.
Sure.
I'm Hannah Perlmutter for Arlington Public News.